Namaskar, friends. Today we will see the 5 stages of insulin resistance. See, this is the one of the 4 key blood markers. What is that? Fasting insulin, HbA1c, fasting sugar, and homoinsulin resistance. The calculation: fasting blood glucose multiplied by fasting insulin divided by 405, it should be below 1.5. And we see what is the status of sugar and insulin. This is optimal, ideal range. What is the ideal range? Insulin should be 3 to 5, A1C should be below 5%, fasting sugar is 70 to 85, homoinsulin resistance is below 1.5. During that time, you see sugar is okay, insulin is okay. Stage 1. I think majority of the people, more than 80-90% of the people are in this stage, friends. Their insulin levels are high, but A1C levels are good, below 5.6%, which is ideal. That is non-diabetic. And fasting sugar is below 99. Homoinsulin resistance is above 1.5. Sugar, whenever they check their parameter, sugar is okay, but insulin is high. Stage 2 is pre-diabetics, insulin resistance pre-diabetes. Pre-diabetes is 5.7% to 6.4% HbA1c. Fasting sugar is below 125, right? Insulin resistance above 3. Sugar is slightly high, insulin is high, very high. And then diabetes means they're fully diabetic. Their HbA1c is above 6.5%. Fasting sugar is above 126. Sugar is high, insulin is high. Stage 4 and 5, basically complications and disabilities. Complications and disabilities means they have some problem with the leg and eyes and all the kidney. Look at it, friend. What happens? See, this is the plasma glucose. Red color is glucose. See, for stage 1, sugar levels is perfectly all right, but insulin is gone up. This is the normal stage. This is what I said optimal. Very few people are there. Then afterwards, sugar levels are okay, but the insulin levels are going up. This is an area of time we must check. This is what is called non-diabetes, but still they are having into insulin resistance, friends. Then over a period of time, then stage 2 pre-diabetic, sugar is slightly going up, maybe below 126 only, 125 only, but insulin levels are going up or slightly coming down. And this is the time when we say, see, the glucose is gone up below 127, above 126. That means he is already diabetic. And that is the time the insulin levels are coming down. The production of insulin levels are coming down. And after some time, the insulin levels are fall below low level. They have to take insulin from externally. Now look at, friend, I have got the 62 people data with me. Last 3 years I have done this data. In this I have mapped the age, weight, fasting sugar, fasting insulin, what is the insulin resistance, HbA1c, D vitamin, B12, whether what is the status. This is NDB is non-diabetic. They are healthy. When you check their sugar level, fasting sugar is good and HbA1c is below 5.7. But look at it, friend. Fasting insulin is a very high for all these people, right? Except 1% out of these 20 people, only 1% is all right, but otherwise everybody has got high insulin levels. And of course, D vitamin level, B12 also is less, that is different. And this is stage 2, pre-diabetics, friends. Pre-diabetics, how many people are having pre-diabetic? Almost 20 people. And look at this one. This HbA1c is 5.7 to 6.4 only. But look at this fasting sugar is by and large is good, reasonably good. Only for 5-6 people it is in the red, below above 100. That too, not even 120 also, 130 also. Right? And whereas the fasting insulin is high, insulin resistance is high, friends. They're all pre-diabetic only. And these are the people who are fully diabetic. Look at their HbA1c is 12.2%, very high. 253 is the sugar, fasting sugar, and up to 6.4. And this age group is between 30 to 73. All of them have got high insulin. See, especially we are making a big mistake in giving insulin and sugar, insulin improving medicine for the diabetic patient. It's not required, friend. What is required is you have to control your food. Look at, friend, insulin resistance, what all it can cause. It can cause heart problem, dementia, stroke, high cholesterol, blood pressure, fatty liver, diabetes, pre-diabetes, overweight, PCOD. All these problems are happening. What is the reason, friends? Primarily root causes for the lifestyle disorder, the toxins in the body, and nutritional deficiency, sedentary lifestyle, and poor mind management, lack of sleep. Poor gut health, insulin resistance, D vitamin and B12 vitamin inadequacy are the root causes of the health problem. What are the reasons? Multiple times eating in a day and taking stimulants like coffee, tea, etc. Friend, We are all habituated to eating breakfast, lunch, dinner, in between one or two times snacks, one or two times coffee, tea. With the result, we are taking 6 to 7 times. Eating 6 to 7 times over a period of 5 to 10 years will cause insulin resistance, lack of hydration, high carb refined foods. What are the high carb refined foods, friends? Especially these maida and then white rice, polished grains and all that. Inflammatory foods, processed, packaged foods, anything processed and packaged has a lot of artificial colors and then preservatives and all that. Lack of nutritious foods. We are eating all the time cooked food. There is no nutrition going into our body. Poor gut health, unable to pass stools 2 times in a day, gas, poor appetite, lack of exercise. This all will lead to in a long-term insulin resistance. Poor mind man, we don't know how to handle the world. Anxiety, chronic stress, they will lead to sleep, lack of sleep in the night. Night sleep is absolutely essential. D vitamin deficiency, B12, you must check and do. Few causes, and all of these causes over a period of time will cause inflammation in the body, hormonal imbalance, friends. So, what to do, friends? Daily schedule to prevent and cure diabetes. How do we do that? Stop eating multiple times in a day. Unfortunately, the doctors suggest eating 5 to 6 small meals, which is a wrong advice. In lifelong, you cannot get rid of diabetes, friends. Stop taking stimulants, coffee, tea multiple times in a day. Avoid sugar, processed, refined foods. Now, what to do? Immediately after waking up in the morning, preferably before sunrise, drink 1 liter water. Focus your mind on your stomach so that you can go to the first bowel movement. After that, you go for a 45 minutes brisk walk, spend time in some sun for 20 minutes, and then come back home, rest for 5 10 minutes, drink 1 liter water again, focus your mind on your stomach so that you can go to the second bowel movement. So 2 times bowel movement would help you to keep your gut very clean, friends, and hydration very well, and you will improve your immunity. Manage stress, and 7 hours night sleep is very important. So eat only twice in a day when hungry and maintain the same timing. What time to eat? Choose your time convenient to you, and eat 2 times in a day when you are hungry and maintain the same timings. For diabetic patients, they must eat no carb food. What is no carb food, friend? Just see here. It's, you can have some egg boiled or fried egg and some curds, some paneer fry, some salads, some sabjis you can have, coconut chutney, some nuts and all that, salads and all that. This is the type of food you can choose. You can have 2 times no carb food within a few days. You'll see that your fasting sugars will come down, and you may have to visit your doctor to reduce your medication, friends. And in between 2 meals, nothing but water, friend. Except water, you should not take anything. Remember, other than water, anything else you put in your body, it requires digestion, and then it escalates the sugar in the body and insulin in the body. So you cannot improve your insulin sensitivity if you are eating more than 2 times. And friend, don't drink water 20 minutes before eating food, while eating, and until 2 hours after eating. And friends, drink balanced 1 to 2 liter water between 2 meals in installments. Suppose you finish your first meal say at 12 o'clock, then from 2 o'clock to evening 6 o'clock, you try and finish 1 to 2 liters. 14 to 16 hours overnight water fasting would help further improve your insulin sensitivity and gut health. You finish your dinner say 7 o'clock, the second meal 7 o'clock in the previous night. So second day up to 11 o'clock, except water, don't take anything, friend. I always tell people, if when God appears and offers you prasadam, don't put it into your mouth, hold it, eat along with your meal. Fasting once in a fortnight with lemon and honey water will further improve your insulin sensitivity and gut health, friend. And friend, my name is, these are the few people who have benefited by following the Wellness Secrets daily schedule. This is life without medicine. And my name is Gangeshwar Rao. I'm not a doctor, friend. And please ensure that these are the 10 parameters you can check and measure your health score. At one time, my health score was 30%. I've improved to 90% in 4 months in 2014, friends. Last 8.5 years, I have not taken any medicine. I am very passionate to share my knowledge and discipline are the gateways to your health, friends. Invest time. If you like this video, please share to your friends. Subscribe to my channel. Thank you very much for listening.